Happy holidays, and thanks for listening to the American Hospital Association's Advancing Health podcast. As we wind up 2023, we wanted to re-release our most listened to episodes from the past year. Advancing Health returns in 2024. In the meantime, enjoy this discussion, and we hope you and your family have a safe and wonderful holiday and a happy new year. Today, Elisa Arispacochaga, AHA's Vice President of Clinical Affairs and Workforce, sits down with Dr. Gaurav Agarwal, Chief Wellness Executive for Northwestern Medicine, to talk about how he is building organizational well-being through sustainability.
Dr. Agarwal, thank you so much for joining me. Please, to get us started, tell me a little bit about yourself and your role at Northwestern.
Thanks for having me, Lisa. I am a psychiatrist who specializes in something called occupational and organizational psychiatry, which really looks at how we can help employers and employees both reach their optimum potentials. My role at Northwestern is Chief Wellness Executive, and with that, I overlook the well-being of our entire workforce.
Wonderful. So lately, headlines have been filled with terms like quiet quitting, and some of these shifts that have happened as a result of COVID-19 in terms of redefining work have really changed a lot of different industries. What do you see as driving some of those shifts in the relationship between employers and employees? As you know, in healthcare, it's a complex relationship there. But how do you see that relationship shifting? And then what kind of impact is that having on your work around burnout and well-being?
Yeah, it's always sort of interesting to see what terms go viral and how people think something is new, but it's sort of been around a while. And I sort of think about that in terms of this quiet quitting phenomenon that the people are like, is this a new thing? And it certainly doesn't feel new to me, even if you think about burnout and sort of having a couple of different parts to it where people get exhausted, and as a protective mechanism, they sort of disengage with their patients in my line of work, because it takes more out of me if I am fully engaged with my patients or Mrs. Smith down the road, versus if I can sort of disengage and think of this person as the woman in room 3. And to me, quiet quitting is just an analog of that, where for various reasons, where employees get exhausted in many different ways, and then they sort of disengage with the employer. So you're just substituting the patient in burnout with the employer or organization in sort of this quiet quitting phenomenon. I think some of the reasons we're seeing this change is some of this is obviously hugely accelerated by the pandemic, but there's been changes in terms of the expectations that workers have of their employers, and vice versa, frankly, over time. If we think about historically, this was a pretty transactional relationship where I give you X number of hours a day doing Y things, and you paid me my salary. And we all just sort of moved on. And as work has really shifted in terms of what the employer's expectations of us are in terms of creativity, teamwork, it's sort of bleeding into certainly non-traditional hours. Then the expectations of the worker has also changed, of the employer, into something that's a little bit more relational, or in my world, psychological, where we expect not only that paycheck, but we really do expect, opportunities to do meaningful work, opportunities to be creative, feel like the work that we're doing is making a positive difference in our communities. Really where we work being a source of a lot of our relationship and belonging that we are seeking. And so when you start thinking about all those different needs that each party is expecting of each other, and then you go through something like the pandemic, where it was hard to really meet all those needs. I think you saw some rupturing of what people perceived as a contract that was broken, and I think we're seeing that in a lot of industries, and there'll be some repair work to do. I also think what you see is people have a lot more options right now. I think the most recent data was something like 1.7 to 2 open job positions for every worker looking for one, and so optionality sort of breeds some higher expectations by workers of their employers, because frankly you can choose a different employer if you needed to. And finally, what we always talk about in change management is it's hard to get people to change or even really imagine change. But once they get to feel it and try it out, that's a huge accelerator of change. And as you all know, people tried out some hugely disruptive things around work from home, etc., and that they never thought were even possible options. And as they had a chance to not only try them out, but try them out for extended lengths of time, the change management sort of works in the reverse direction. Getting them to go back to the way it was is frankly unlikely.
No, absolutely. And I think there's definitely something to be said for this idea that we've, not only we've tried all of these new things, and now what we did before almost seems like a distant memory. I really like what you said about looking to their work to find meaning and connection to purpose. I know that's been a discussion we've had when talking about burnout, about one of those avenues to really help people re-engage with their work and reconnect to that purpose. So I think it's of so much value to understand that when, and I've certainly seen it as I've interviewed people to hire in our own organization, really looking for that. How does this job make a difference? How does this job help me make change in the world? So I think that's, you're right on. It's something we've been seeing changing for quite a while. So as a leader who's now in charge of addressing well-being in your organization and really leading this work, how are you thinking about this conversation in your organization and reframing it, not just about, addressing burnout or increasing resiliency, but moving your organization really towards sustainability?
Yeah, I think it's a great question. And, part of my interest in this is that when I do talks or I'm just speaking with our leaders or our frontline folks, there's always this moment where we start going, when you say wellness or well-being, what do you mean by that? And I find it actually to be quite a difficult question to answer, because well-being is so broadly encompassing. And it's also challenging to me because people have their notions of what wellness means. And a lot of times it does still focus in on the individual. And, you've obviously been a leader in this work of if we think about healthcare well-being, there's been a huge shift to trying to make sure people recognize that we mean, how do we make the work itself, our work environments, our workflows, be healthy, right? So we're not just working on the individuals, we're really working on the environment, the workflows, and the work itself being done in a way that is sustainable. And that's sort of where it came to me is if that's really the goal, and this concept of sustainability is, I think a little bit better embedded, frankly, in the business lexicon, then perhaps that is a good shift for us to make, because it really puts the focus squarely on where I think the evidence has really shown us we have to do all the work, which is, again, the work environments, our workflows, and designing work in a new way. I think there's a lot of good work that's been done on the margins here, but if you talk to most people, I think there is this real sense that we really are going to have to do things differently in healthcare. We can't just do stuff around the margins if we're going to make a meaningful dent in this space. And so, for me, I like the sustainability framework. I like the idea of you know, when we talk about it from a growth perspective, everybody is seeking quantifiable growth in their business, but sustainability really gets this idea of the quality of growth matters as well, right? We can't just be thinking about productivity and growth in a vacuum. We have to understand that if we're going to seek these things, we want to make sure that as we grow, as we take care of more and more patients that are complex, how are we doing that in a way that works? I also think it resonated with me because the truth was, we had to sprint during the pandemic. There was no choice during these surges. You weren't doing something that was sustainable, but that was okay. That's what was necessary for a sprint amount of time or sprint amount of distance. But now, our careers are marathons. They're not sprints. And we all have to be pretty mindful of that, is that you can't do that surge pace forever. That's a setup for breakdown of both your own body as individuals, but also a setup for breakdown of organizations. And so, again, the sustainability thing, at least to me, whenever I hear that word, it sort of has certain resonance in my brain about, how am I crafting work to be done over the course of a marathon, and recognize that a sprint pace is not sustainable.
Absolutely. And we've talked about this idea of, sort of adopting some of this analogy of a sprint versus a marathon. And you don't decide to run a marathon on Sunday when you've never left your couch for more than 10 minutes. You have to really build that ability to continue to do at the same pace. And you can't, you can sprint to the store or sprint to the end of the block, but there's a need to build in that ability, and that it does require some training to think about not only how you run a marathon, but how to pace your career and really pace yourself and find those places that are going to reconnect you to purpose and give you that rest and recuperation time. I really love the program that you've started at Northwestern, and I'm going to ask you to tell us a little bit about how you use the Scholars of Wellness, which really is almost a grassroots well-being effort, to really drive some of the engagement in the work at Northwestern.
Yeah, I think for us, it started a while ago, and I always tell people I don't care to share with you how many wellness committees I've been on throughout my life, and how few of them really seem to be able to implement the changes that we all wanted to see. And after a while, I just couldn't figure out, or I really wanted to figure out, frankly, why that was, because there were incredibly passionate, talented, smart people on these committees, but we just really couldn't move the needle. And it finally sort of seemed to be that there was a certain set of skills and knowledge that local people that had to be involved in these changes needed to have. And frankly, we're not really trained with those skills or knowledge when we go through our medical training. And those three buckets are, there is a wellness science to this work. And it's really important to know that wellness science if you're going to sort of follow what the science tells us will actually make a difference in well-being or sustainability. You have to understand how organizations work from a quality improvement, process improvement methodology. Because again, if we're changing systems, then changing systems is very different than me changing how I see a patient, where I just have to change my own behavior. Changing a system is a whole different beast, and knowing some of those processes is crucial. And then finally, the lesson I learn all day is change management. Is again, there are so many good ideas out there that people are like, well, it's such a good idea. Why doesn't it just happen? There's a large body of literature around how change management occurs. What are the reasons people are always nervous for any sort of change, whether it's desired or not, and how do we manage that? And so those three buckets of skills and knowledge, we figured if we could deliver to local people, they could then take what their expertise is, which is how do I work? How should we work to provide the best patient care in a sustainable manner? They could take that expertise and run with it if we could provide that other set of skills and knowledge. And that was sort of the big idea, if you will. And this program has been really integral to us in creating this continuous improvement philosophy, right? People always say, well, how will you know if you've achieved your wellness goals? And I said, the truth is, I don't think that's how wellness works. It's a continuous improvement process that we never will reach an endpoint to because we're defining it as continuing to improve the work itself and our work environments. And those things will always need to be tweaked and changed, particularly as we change how we deliver healthcare. And so getting local people involved who know their work best, know their work environments, workflows best, has been, I think, crucial to really helping people develop a shared vocabulary that this is what we mean by well-being. This is what we mean by creating sustainable work.
Absolutely. And I know in the well-being playbooks that AHA put together, which you were integral to helping us develop, that's one of the first slides I always introduce is ask the people doing the work, because they know where the problems are. And I think that's one of the key issues is that they need to own the solution. And we just need to make sure we give them the tools to do that. And so I love the formation of this program and how it's been able to really drive work at a very local level across your system. So as you think, to other organizations, those who are listening to this, what can they do to try to move more towards a sustainability framework as they're thinking about their well-being journey with their team?
Yeah, I mean, I think for me, it's a little bit about creating a shared vocabulary, right? Again, the wellness work is often ambiguous to people, and so if this resonates, particularly from a business case perspective, I think that speaking a language that's already existing helps the change management process. I also think it'll help you gain credibility with your local folks because, we all sort of think about that, right? And when you talk to people, you hear this thing is, I don't know how much longer I can do this. Well, what they're really saying is, I don't know how sustainable this work is. And so when we start talking with the language that resonates with people, again, that then you can get some positive head nods, and you're sort of looking for that, especially when you're just starting out. You're looking for those yeses that can sort of drive those small wins and start building that momentum. And so for me, it's a language that resonates with both of the key stakeholders here, and that they can all sort of rally behind. I also think, again, for me, it's how do I make it seem like it works with my life, and so I always try to share those ideas of, when I took this leadership role on, for instance, one of the best pieces of advice I've ever received in my career was, make sure you don't have too many titles. You probably should only have one. You probably should only have one, but at the most have two. And I was talking to some people recently who, the longer you're at an organization, you sort of become a collector and you pick up these little titles and roles that you do, and before you know it, your calendar's totally booked, and you're in a bunch of meetings, and it's hard to really stay focused and do good work when you're just sort of jumping from meeting to meeting and don't actually have time to do the work. And so when I think about my work as a coach, I always think about job crafting and career crafting and life crafting, and all of those things are based around this concept of, okay, if I'm going to create my ideal job or career that's sustainable, then this is what I need to do. This is the time blocks I need for thinking, the time blocks I need for executing, the time I want to protect for my family. And so, you can start sharing those ideas of building a sustainable career, and I think that can help generate the momentum at an organizational level too.
That's awesome, especially since I think most of my thinking time is on the elliptical early in the morning. So I probably should block more time during the day for that. But No, everyone knows not to interrupt me early in the morning because I am not available for meetings before the gym. But yeah, I think you need to really craft those spaces in your life where you know these things are going to make me a better colleague and a better person. So let's wrap up with sort of a combo question of, for those who are in organizations who, may have just gotten added the title of Chief Wellbeing Officer or something along those lines that have to support this work. Is there one or two pieces of advice you have for them? And then more personally from, as a still practicing clinician and an executive with these roles, is there one piece of advice, you shared one, is there another that you would give to, one of your colleagues who was just starting in this path?
Yeah, let me, let's take the first one. If you're a new chief wellness officer, and full disclosure, I'm fairly new as well. I think for me, it's been about being very clear about what you own and what you have the ability to influence on, and really being clear with yourself, but also being clear with the people that you report to about those issues. I think is really important, because otherwise, we all want to do good work and we all want to make a difference, and I think you quickly can quickly get overwhelmed, frankly, right? Because again, if we're thinking about this as sustainability, everything an organization does falls under sustainability, and yet you do not own or control all of those circles. And so being clear about what you own and who you need to partner with to influence the other aspects of sustainability is really critical for my own well-being. At least that's what I can say to that. I think your second question was around, what have I used around what piece of advice would I have? And I think for me, it's really celebrating small wins. The power of small wins is really underappreciated. The problems and challenges are big in healthcare right now, and I think everybody is at risk of wanting a quick fix or a silver bullet. I personally do not know that silver bullet or that quick fix. And so this is a journey that we have to go on, and to be able to have enough energy to sustain us on that journey, we really do have to celebrate those small wins as teams, as with your organizational leadership, because I have found that those small wins open up so many opportunities that you couldn't even imagine before the small win happened. And so being able to do that, I think, is really critical.
I love that idea. I had a friend who used to, with her team, they had a small accomplishment Thursday. So every Thursday they would go around in their meeting and just highlight what they'd accomplished in the previous week. Could be any size or, level of accomplishment, but it was something that they had gotten done that had been on their to-do list. So I think celebrating the small wins is definitely a way to chalk up to some of those bigger wins.
That's really clever. Yeah, I mean, I think the research is clear, is that when what people are looking for in work is progress, right? They're okay with not getting there, but they're really looking to feel like they're making progress towards their goals. And so small wins are crucial to that.
Well, gee, thank you so much for joining me and for sharing your thoughts. I really appreciate it, and we'll continue to follow how you're doing on creating sustainable well-being.
My pleasure. Thanks for having me.